Okay, so today we are going to learn how to use the lymphedema pump. So the OTs use the lymphedema pumps in the burn unit quite a bit, and then sometimes on other floors also in there just to help with swelling. And so this is what the pump looks like. So it's typically kept down in the PM&R department over in the cabinets by the outpatient physical therapy area. So, if you are asked to pump somebody, you'll want to make sure you get this machine here, and then this tubing goes with it. You want to make sure you have the red, the white, and the blue. You will want to find a very official garbage bag, a clean one, and this a lot of times I'll just steal from one of the housekeeper carts in the hallway. And then we have a couple of different sleeves. If this is an arm sleeve, so you'd want that one for an arm, and then this is the leg sleeve. It goes down and then has the little curve for the foot. So the therapist should be aware of any contraindications to the pump, but in case something new is going on, when you look at the chart or talk to the nurse, you would want to let the therapist know before you pump the patient if they have any concern for a DVT, any concern for a new active infection, congestive heart failure. I think those are the main things. So just be sure to notify the therapist if you have any concerns about that, and then always check with the nurse before you put the pump on the patient. So, okay, now I will show you how to actually put the pump on the patient. Nathan is our patient here. I'm going to put the pump on his right leg. So what we're going to do first is put our little garbage bag here, and all this does is give a barrier between the patient and the sleeve that we're going to put on their leg. So are you able to help lift your leg up? Occasionally, if you have a patient that has a very large leg and can't lift their leg up, it might be helpful to have one of your friends there to help lift the leg if you need it. So. Okay, so then I'm going to put the leg sleeve on. Again. Just try to get the foot down here. Sometimes it's a little bit too long, and that's okay. Okay, and then you're just going to zip right here. Zip all the way to the top. Okay. And then the pump is typically used for swelling, and it can be more effective if the extremity is elevated as we're pumping. So I'm going to go ahead and put a couple of pillows under his leg. Does that feel okay? Okay, so we want it just up, elevated above his heart. Okay, so next comes our tubing. So you'll see here on the side we have a red, a blue, and a white. And so basically you're just going to take your red tubing, it's going to plug into the red. The white goes into the white. And blue goes to blue. And then you're going to do the same thing over here on your machine. You also have red, white, and blue. So just match white to white. Blue to blue, and red to red. Okay. You want to make sure your pump is plugged in, and then you're just going to turn it on here. So just flip the switch to on. It'll start to make that noise, and the sleeve will start to air up a little bit. As far as the pressure goes, the therapist will let you know what pressure we're pumping the patient. Most often it's about 35 millimeters of mercury. And so this is our pressure control right here. So you can just slowly start to turn it up. And sometimes it takes it a little bit to ramp up, so we'll give it a minute. Yeah, it's gonna go real high. So I'm gonna turn it back down. We're about at 35. You want to stay with the patient for a few minutes while this airs up, and just make sure that they're tolerating the pump okay. And then be sure you set a timer for how long the therapist wants you to pump. So it could be anywhere from 30 minutes to an hour. Okay, so now I will show you how to take off the pump. So you'll just turn your switch to off here. And then you can go ahead and just unhook here. and unzip. So the sleeve, you can use the cleaning wipes and just wipe it down thoroughly and take it back to the department. Unless if you have a patient that's on contact isolation or has some kind of very contagious bacteria in the burn unit, you may want to just talk to the therapist if they have any other instructions about cleaning it. And then the trash bag we'll just take off and throw away. All right, and then you can just let the nurse know that the patient is finished with their pumping for the day.